I now call on Her Excellency Marcella Liburd, Minister of Health, Social and Community Development, Culture and Gender Affairs of St. Kitts and Nevis. You have the floor, Madam.
Mr. Chair, Excellencies, let me, on behalf of the government and people of St. Kitts and Nevis, join those who have preceded me in congratulating you on your assumption of the chairmanship of the Commission. Our delegation also joins in commending you for so ably presiding over this 58th session of the Commission on the Status of Women, bringing into sharp focus the myriad achievements and challenges faced by women globally. My country therefore aligns itself with the statements made earlier by CARICOM, G77 and CELAC. I am also honored to be representing the Federation of St. Kitts and Nevis today at this august body as it reflects on the challenges and achievements in the implementation of the MGDs for women and girls. Mr. Chair, like much of the Western Hemisphere, St. Kitts and Nevis from the 1600s onward endured centuries of extreme oppression based on race. My government therefore decided a long time ago, in keeping with our government's philosophy, that not only would there be no oppression or discrimination based on race in St. Kitts and Nevis, but neither would there be discrimination of any kind, not on class, not on religious affiliation, and certainly not on gender. As a result, although we are one of the tiniest nations on earth, we have a society in which women in leadership roles is not uncommon, from national security to finance, from investment promotion to tax collection, from our diplomatic corps to our judiciary and our clergy. Women in positions of leadership in St. Kitts and Nevis is fast becoming the norm. However, this accelerated pace of change is still not sufficiently reflected in our private sector boardrooms and in our parliament. Mr. Chairman, the fact that more and more women are assuming positions of leadership may have a lot to do with our education policy over the past 50 years. In St. Kitts and Nevis, education has been compulsory and free, both at the primary and secondary level for boys and girls alike. This system of mandatory free education, Mr. Chair, is both the cornerstone of our country's socio-economic stability and an intergenerational national treasure. Where do gender-based inequities in our country lie? Mr. Chair, men and women by law receive the same income for the same work. Gender-based inequities lie in the income differences between men and women generally, as on average, men traditionally occupy the higher-paying jobs in areas like construction, while women traditionally occupy the lower-paying jobs in manufacturing and home care. This is why I am pleased to be able to report that today in St. Kitts and Nevis, there is a sustained nationwide program underway that provides funding and training to women in traditional lower-wage fields of employment in order to equip them to compete in higher-income, traditionally male areas of economic endeavor. I am also pleased to report that St. Kitts and Nevis had made tremendous strides towards achieving the first MDG to eradicate poverty. Our government has invested heavily in creating a solid and expansive social protection program aimed at assisting vulnerable families to lead dignified lives. Cognizant of the fact that the majority of single-parent households are headed by women, my government has also put in place a carefully developed assistance program to enable these women and their children to be able to move forward and upward in the areas of housing, post-secondary scholarships and/or grants, and skills training as a means of upward social mobility. I should perhaps mention here also, Mr. Chair, that so focused are our healthcare services in St. Kitts and Nevis that maternal and infant mortality are practically unknown. I must highlight the significant achievements my country and the region have made in addressing and bringing to the attention of the international community the high incidence of non-communicable diseases and in stemming the HIV epidemic. Coverage with ARVs have increased from 5% to 67%, and new cases of HIV infections among children dropped by 32%. The estimated coverage of ARVs for pregnant women living with HIV increased from 55% to 79%. Mr. Chair, my government has been providing legislative support for these policies and programs. The passage of the Equal Pay Act, the Guardianship Act, the Maintenance Act, the Child Justice Act, and the Human Trafficking of Persons Act all focus on gender equality and strengthening of the family unit. The current draft amendment of the Domestic Violence Act reinforces our zero-tolerance policy. Violence against women and children must not be seen as either a personal or a family matter, but instead it should be seen as socially destructive behavior demanding judicial intervention by the state. This session comes at an opportune time as we are at this very important stage of assessing our progress in relation to the MDGs and charting a way forward through the post-2015 development agenda. We must not leave women and girls behind. Women must have a voice in the post-2015 development agenda. We must invite men and boys to participate in the dialogue. We must not repeat the mistakes of the past. And so, Mr. Chair, I end where I began. In St. Kitts-Nevis, our policies, practices, and programs encourage and facilitate the full flowering of women and girls. And we do this not because this is the best for the women involved, but because we understand that the stability and advancement of our families, our communities, and our nation demand no less. Thank you, Mr. Chair.
I thank Her Excellency for her statement.